Hey friends, welcome back to the channel. If you're new here, I am Jennifer Huber, also known as Solo Travel Girl, and it's laundry day. I'm surrounded by laundry. I feel like I'm being pushed off my sofa because I have Radcliff here, my dog. He just had a bath, so he's feeling sorry for himself. Also, I have been using Mounjaro since June of 2022, so that's well over 2 years, and I'm here to provide you an update of what's been happening with me the last few weeks. I contracted Lyme disease earlier this summer. Many of you know that. And let's see, let me get my timeline straight. The beginning of August, I had a blood draw and my A1C was 5.6. And because of that, and that was the second time this year that my blood draw was 5.6 for my A1C, which is awesome, which is a normal A1C. It's not necessarily diabetic A1C, even though I will always be diabetic. My doctor reduced my metformin from 1,000 milligrams of metformin to twice a day to 500 milligrams of metformin twice a day. I'm on 7.5 milligrams of Mounjaro once a week. And then this happened on a Monday that my my healthcare provider reduced my metformin. And then on that Friday of that week, that's when I found the bullseye rash for Lyme disease. On that Tuesday, the day after I had my physical and had my metformin reduced, that's when my neck pain and stiffness began and fever and everything. So I had, as you know, I was on 2 rounds of antibiotics and then I was on a steroid for a month. I had my A1C tested last week, and I can't believe how bad it is. It is basically 7. So I went from 5.6 3 months ago to 7.0 in 3 months. That's how I'm disappointed in myself, but then I had a eye doctor appointment, and she said, the steroids are going to do that. They're going to increase your A1C. So I'm guessing it's because the combination of the steroids and then lowering my metformin. Plus, I know I wasn't eating properly. I was wearing the Stelo glucose monitor, and it did indicate that my blood sugar was high at points, and I just was feeling really off. I've been feeling really good the last couple of weeks, with the exception of yesterday and today. I don't know if it's just old age, 54 years old, but yesterday my whole body was sore. And today I just wasn't feeling it. I've just been feeling kind of blah lately the last couple of weeks, and I guess a little bit empty inside, so to say. But it just really felt really difficult yesterday. Maybe that's depression. I guess that is a sign of depression. So today I did make myself get out of the house and run some errands up in Sarasota. It's about a 45-minute drive. Did a little shopping for something I alluded to in my last video. Had a nice lunch of fish tacos and went to some beaches, although there was red tide, so I could tell there was red tide as soon as I stepped out on the beach, so I really didn't stay very long. But I feel better than I did yesterday. Also, I know it was a full moon yesterday, and with Lyme disease, the moon can trigger Lyme disease and trigger inflammation, as I'm learning. So what else is new in the health field? I went to the dentist, or I had my teeth cleaned. My dental hygienist said that he noticed that there's more plaque on my teeth than usual, and thanks to Google, I found that that could be a side effect of Lyme disease. So we'll see what happens when I go in the next 6 months. And then I had as I mentioned earlier, an appointment with my eye doctor, and I talked about this smudge in my eye, this giant floater, and she definitely saw a giant floater, and she said, when you turn about 60 or so, things start happening in your eyes, so it's not uncommon to see floaters, large floaters like that. However, she said possibly Lyme disease did accelerate this happening, and she did say it should go away. And if you watch my other videos early on with the Lyme disease, I was seeing all sorts of weird things like polka dots and bright flashes and like lightning bolts and all that, and that has subsided. So she just said if I do see that again, to make sure that I go and give her a call so she can look at it. So basically, in sum, I'm feeling a little bit defeated with Mounjaro, with Lyme disease, but I just need to have faith that I am getting on the right track with my health, that I'm beating Lyme disease. Maybe it was just a fluke that I felt off this weekend. Now, Friday, I did have a big volunteer event. It was a 6-hour event. We're on our feet for 6 hours, and basically my team and I, we handed out over 300 turkeys, frozen turkeys, and Thanksgiving fixings. So perhaps being on my feet all day on Friday, and I haven't done any exercise other than walking my dog twice a day, and we've had some long walks. Some days I walked 5 miles, not in one setting, but combined twice a day, total combination of 5 miles. So maybe that's it, and then just the aging process. So I feel defeated right now, but I am optimistic things will turn around. But yeah, so I did book a trip to Fairbanks, Alaska in January, and I'm hoping to see the Northern Lights, the Aurora Borealis. I have a couple dog sledding adventures booked. The downside of traveling solo is that some activities require a minimum of 2 people, and if you don't have 2 people, and if you're just one person wanting to go, you need to pay for 2 people. So be it. And then I have hot springs booked, and I'm just looking forward to it. I just think it's going to be a good decompression for me, something to look forward to, something to plan. And then when I get back from that, we'll see where life takes me, so to say. So anyway, that's all that's new with me. Thank you so much for watching, and I hope you're having success with Mounjaro. And remember, one, don't compare your journey to my journey, because it's going to look different. My journey is looking different from someone else's, and I know someone else's is looking different than yours. So, just stay the path, and remember, it's about being a healthier version of yourself. Lowering your A1C is the most important thing, and that's the main purpose of Mounjaro. The weight loss, that's a nice side effect. And speaking of, I told you in my last video that I was 144 pounds. That was a gain of 11, 12 pounds. I have lost 2 pounds since then, so we'll see. Maybe when I get back to exercising regularly, perhaps I will get back down to 135. All right, my friends, thanks so much for watching, and remember, not only be kind to others this week, but please be kind to yourself. Bye.